Good morning. Can everyone hear me okay? As the Dean of the LSU Health Science Center School of Nursing in New Orleans, I would like to welcome our students, faculty, and guests to our inaugural Fall 2024 White Coat Ceremony for the LSU Health Science Center New Orleans School of Nursing at Shreveport campus. Additionally, I would like to acknowledge the families, significant others, and friends who have supported each one of our nursing students to reach this stage in advancement of their professional studies. They could not have done it without the family and support systems. I'd like to begin by providing a brief explanation of what the White Coat Ceremony's significance and inspiration is about. The White Coat Ceremony was originally designed by the Arnold P. Gold Foundation as a way to welcome new medical students into the healthcare profession and to set clear professional expectations through the reading of a public oath. In August of 2014, the Arnold P. Gold Foundation and the American Association of Colleges of Nursing hosted inaugural White Coat ceremonies throughout the United States. So today, the ceremony is shared by schools of nursing, medicine, and other healthcare professionals in all states to emphasize the importance of compassionate, patient-centered care as well as scientific proficiency. Traditionally, White Coat ceremonies are symbolic robing to remind students of their commitment to their patients and their promise to engage in patient-centered care and humanistic care. This ceremony represents the nurse's responsibility to put the interests of patients first and affirms the obligation starts on the first day of nursing school clinicals and continues throughout the nurse's career. Further, this White Coat ceremony is considered a rite of passage, welcoming you as a new nursing student into the profession. Some acknowledge and recognize the White Coat ceremony as a symbolic conversion of a layperson into a member of the healthcare profession. As nursing students, once you receive and accept your white coat, you are ethically and legally bound by the same professional commitments that bind all registered nurses. This ceremony joins the white coat symbolic virtues of altruism, responsibility, duty, honor, respect, and compassion with the School of Nursing's core values, which consist of stewardship, organizational citizenship, nursing innovation, caring, professionalism, respect, integrity, diversity, and excellence. The white coat will serve as a reminder of your professional obligations and a symbol of, your professionalism. I want to talk a little bit about the white coat's length. The length of the white coat has a significant meaning. Short white coats epitomize the role of the nursing student as a learner and a novice nurse. The longer white coat symbolizes the wearer as an experienced member of the profession. Today, as faculty and nursing students, we will wear our white coats together symbolically to represent the essential role in providing compassionate care and excellence in healthcare delivery. So here is the meaning and the symbolism that is attached to our ceremony that we're experiencing today. Now, at this time, it's my pleasure to introduce our keynote speaker, Dr. Sharon Dunn. She serves as the Dean of the School of Allied Health Professions and also a professor of physical therapy at LSU Health Science Center here in Shreveport, and will deliver our keynote address. Dr. Dunn earned her bachelor's degree in physical therapy, a master's degree in health sciences, and her Doctor of Philosophy in Cellular Biology and Anatomy from Louisiana State University Health Science Center in Shreveport. Dr. Dunn previously served as the director of the physical therapy program for 15 years, and she continues to teach professional issues, anatomy, and orthopedic physical therapy entry-level program, and advanced anatomy and rehabilitation sciences in the post-professional residency and PhD program. Her clinical practice and board certification is in orthopedic physical therapy. Dr. Dunn's research interest includes conservative clinical approaches to the management of common musculoskeletal conditions and translational research of applied mechanical loading to healing tissue to determine dosing effects on the ultimate functional and biomechanical tissue integrity. Throughout her career, Dr. Dunn has been professionally engaged in efforts to promote public policies to enhance the public's access to high-quality health services and excellence in practice delivery. She served as the president of the Louisiana Physical Therapy Association from 1997 to 2000 and is the immediate past president of the American Physical Therapy Association that served the term from 2015 to 2021. Dr. Dunn has significant experience in organizational operations and integrity, health policy, advocacy, and the collaborative approaches to healthcare delivery. She advocates for a team-based approach and patient-centered management for better health outcomes in our communities. It is my privilege to welcome Dr. Dunn to the podium, and I also would like to add that Dr. Dunn has been instrumental in starting this program and give her the acknowledgement, because without her assistance, it would have been very hard for us to initiate this program. So Dr. Dunn, we welcome you as the keynote presenter, and it's, I think, appropriate to have you as our inaugural speaker since you've given so much to this program. So thank you, Dr. Dunn.
Look at that. Did I do that?
You good?
Good. Y'all can start your clinical work on the platform party. We got plenty for you to do. Dr. Porsche, thank you for that warm introduction, and I am truly honored to be the inaugural speaker for the White Coat Ceremony. Dr. Today, all the distinguished faculty and staff that are here, but mostly to our honorees, the 6 of you who stand ready to don this white coat, and then your family and friends who have joined you today for this most important event. I'm truly privileged to be invited to celebrate with you today. The white coat, as Dr. Porsche just talked about, signifies a public expectation. As you don this symbol, recognize that vulnerable people will share with you their deepest, darkest secrets in the hopes that you will help them. That expectation is that you will honor their trust and with complete confidentiality and earnest effort to fulfill your duty of care. And by virtue of this ceremony, your faculty deems you worthy to be unleashed upon the public, with supervision, of course. I'm a physical therapist by clinical preparation, and many of you in the audience, nurses, have encountered physical therapists in your clinical roles, and we tend to be aggressive and obnoxious and in a hurry. Is probably why I broke my ankle. But I've encountered nurses along my career who have helped shape me into the clinician and leader that I've become across my career. The first director of nursing that I ever encountered was a woman by the name of Pat Benefield. I don't know if y'all remember Pat. She was the director of nursing over at the Academic Medical Center, and she was a presence. What I learned from her was leadership and high expectations of her nurses. When she came onto the orthopedic floor, everybody jumped to attention because she meant business. But I also learned from her a fierce advocacy for those she leads and serves. And she would go to the wall for her nurses. More than that, she would go to the wall for the patients under their care. And an amazing leader and role model for all providers. The second person and last person I want to talk about was the director of nursing on the orthopedic floor when I was a young physical therapist. I would go to the floor and disrupt her day, essentially. People up, IVs pulled out, catheters stuck to the bed, pulled out, get everybody up and then leave the floor. But I would do my duty. I'd tell the nurse, hey, about 8 patients are up. Bye. and as we know, nurses are short-staffed, always. Not enough nurse techs. So she called me one day. Her name is Janice Smith Cozine. She would answer the floor, Smith RN, get your back up here. I need help putting these people back to bed. So she and I had a heart-to-heart one day about what a back-to-bed service was. And I had handed off responsibility to her in my thoughts, and she didn't have the team to make sure the patients were safe in their mobility needs. So she told me just what in so many terms. And then we went on to be amazing friends and colleagues. We established team-based care on the orthopedic floor. It became one of the most efficient and effective services, full unit, very few providers and assist, but she taught me a lot about patient-centered care and team-based care, and I've carried that through my career. She passed away prematurely from lung cancer, but I think about the lessons I learned from Smith RN on a daily basis. So I'm thrilled to have this off-campus instructional site here on our campus because I have nurses, again, to continue to learn from. And we didn't have a nursing presence on this campus until you all started. So congratulations and thank you. Healthcare has taken a hit in our workforce through COVID and post-COVID and has waged on afterwards. Most health professions lost significant numbers of providers over the last 3 years, and what that means for you when you graduate is that you will have a solid job market across healthcare delivery systems. Name your setting, and there's a shortage of nursing and excellent opportunities for you. So hang in there. It's not easy. You wouldn't be here if you did not have a deep commitment to serving others. And I know this CARES program that you're in is fast track, it's rigorous, but the product, what you will graduate with, is priceless. Few people can say that they absolutely love what they get to get up and do every day. And you are truly blessed to have a profession where you make a difference for people every day. I have a few words to share with you as you embark on your continued academic goals through your clinical experiences and during this threshold of potential. And I call it a threshold and potential because this momentous occasion is only a beginning for you. And if you serve a 30-plus year career like those of us before you, it is a beginning, and it's a lifelong learning opportunity. 3 points to make with a few words to live by are quotes from others that have helped guide me through my career. One is, nothing worth having comes easy. 2 is, real satisfaction in life comes through humbly serving others. And 3, gratitude is a healthy practice. Never forget those who helped you achieve your goals. Better put, grit, humility, and gratitude will take you further than you can ever imagine. And you all are experiencing grit right now, what it takes to get up and study and continue this rigorous academic program that you're in. It takes hard work and multiple failures to accomplish a hard-earned goal. As long as you see failure as a learning opportunity rather than a fatal and final outcome. Grit is a characteristic of a tenacious and determined individual, and it's found to be more important to success than intellect. Thank goodness. Webster defines grit as firmness of character and an indomitable spirit. Angela Duckworth was the founder of All We Know About Grit today. She's got a TED Talk that's got millions of views on it. She identified the trait while teaching 7th graders in an inner city public school in New York City. Her definition of grit is perseverance and passion for long-term goals. It's long obedience in the same direction. It's about rolling up your sleeves to see a job through to completion. It's about having high expectations of yourself, regardless of what others are doing around you. It's being the go-to person in the clutch situation. Dependable, consistent, reliable. Pursuing your goals, as you're doing right now, drives your grit quotient. It's what got you this far. So whatever your dreams are at this threshold of potential in your life, Pursue it with all you have, and they will eventually come true. Success will take grit, but don't let others rain on your parade. Perhaps that dream was deposited in your spirit because you're the only human being on the planet who can pull it off. So keep running towards your goal and your dream. A couple of quotes, words to live by related to grit. Attitude more than aptitude will determine your altitude. That's a Zig Ziglar quote. And then Ben Franklin said, well done is better than well said. So stay on the path. Second point, observation, humility is critical. As you learn more, sometimes it's hard to be humble when you're perfect in every way. But as you humbly serve others, that's the greatest satisfaction in life, making life better for others. The Dunning-Kruger effect is a scientific, it's been proven that competence and confidence are inversely related. In other words, those of you who already think you know everything, you're a danger to yourself and a menace to society. Or as Bertrand Russell put it, the fundamental cause of trouble in the world is that the stupid are cocksure while the intelligent are full of doubt. So if you have a healthy fear, that's a good thing. It means that you're competent and you're not overzealous. Humility is knowing you can't possibly know everything, then surrounding yourself with others who complement you in the areas of your gaps. I learned this through my career, both personally and through observation. It may be more comfortable to surround yourself with yes people, but it stunts your growth and innovation. Humility helps you identify that it's far better to surround yourself with those who readily disagree with you and challenge you. You learn more, the journey is much more interesting, and the product is better when tested and vetted through the fire of criticism and debate. Nothing good comes from decision-making in a vacuum. Abraham Lincoln knew this truth. If you want to know more, read the book Team of Rivals. It's thick, so you got to be on a semester break to get it. But it's about President Lincoln's deliberate choices of his political adversaries to fill his cabinet and how they went on to accomplish the impossible. Humility also allows you to recognize and appreciate criticism as the gift that helps you grow. It's hard when you don't make a perfect score on a practical. It's hard when you have a clinical faculty member correct you, maybe in front of a classmate or a patient. But it's much harder to correct on their side than to ignore. So as you embark on your career and your clinical experiences, and in particular, what you're about to embark on through your learning in this program, realize that anyone willing to invest the time and energy in correcting you must see some potential in you. They should be appreciated rather than despised. So if you listen and apply their instruction, these people will be your greatest champions in life and in your future. And I would say if you ever need it, but when you need it. Words to live by related to this. Cleo May Dungy is Tony Dungy's mom, and in his book he talked about her quote, "Excellence that feels it has to be proclaimed by the mere fact of its proclamation admits the doubt of its existence." And then I'm going to quote a little scripture here, Proverbs 27:2, "Let someone else praise you and not your own mouth, an outsider and not your own lips." Humility. It goes a long way. And then finally, gratitude. Gratitude is the end game or outcome of your humility. You recognize others have contributed to your success, and you're so grateful you want to honor them with your continued best efforts. Be sure to thank those who have played a part in your success, and I think many of them are in this room. Be specific as you express your gratitude. Words to live by here. One is Brené Brown. "I don't have to chase extraordinary moments to find happiness. It's right in front of me if I'm paying attention and practicing gratitude." The miracle of gratitude is that it shifts your perception to such an extent that it changes the world you see. That's from Dr. Robert Holden. It's been my great honor and privilege to see y'all come through your first semester and to work with your faculty. I think the future is incredibly bright for the profession of nursing and for our academic programs. You are joining a most noble profession and surrounded here this day by people who care deeply about your success. I'd like to personally thank the nursing faculty and all I've learned from you. I also want to thank all your family and friends who are here today to celebrate you. And a big shout out to Miss Sam Darby, who worked tirelessly to prepare for today's events. Thank you for having me, and congratulations.
Thank you, Dr. Dunn. Truly inspirational words, and I do want to pick up on the fact of gratitude and humility. It's very important as we move in our profession. And it is true that, you know, the grit really can really top intellect. I mean, you really have to be able to persevere through the profession and through your studies. And I think we're now learning that it is actually better than, as you were saying, intellect. So we appreciate your words. At this time, we will commence with the cloaking of our nursing students. To assist with the cloaking are Dr. Linda Leday, Assistant Professor of Clinical Nursing and Director of the LSU Off-Campus Instructional Site, and Dr. Glennia Jackson, Instructor of Clinical Nursing. And to assist also is Dr. Todd Tardivo, Assistant Dean for Student Services. During the cloaking, our students will be publicly acknowledged with the reading of their names by Dr. Jennifer Manning, Associate Dean for Undergraduate Nursing Program. Each student will receive a white coat and the pin from the Arnold P. Gold Foundation and a pin from the LSU School of Nursing. The specifically designed LSU School of Nursing pin has our core values listed. The pin serves as a visual reminder of your oath and your commitment to providing high-quality care. The students will also be assisted with the signing of their names in the White Coat Ceremonies archives to represent their dedication to humanistic, patient-centered care. Dr. Manning?
Thank you, Dr. Porsche. As I read your name, just come up and we will cloak you and we'll take a picture. Our first, Rosemary Ashley Chamberlain. Josiah Ladd. Anna Montgomery. Angel Alicia Joy Morris. Dushawn Stinson. Alana Wilson.
Thank you. Our nursing students and faculty are all invited to stand and participate in the recitation of the White Coat Pledge, which may be found also in your program. The pledge will be led by Ashley Chamberlain, CARE 2025.
Good morning. You guys ready? As a nurse dedicated to providing the highest quality care and services, I solemnly pledge that I will consider the welfare of humanity and relieve suffering, act in a compassionate and trustworthy manner in all aspects of my care, apply my knowledge, experience, and skills to the best of my ability to ensure optimal outcomes for my patients. Exercise sound professional judgment while abiding by legal and ethical requirements. Accept the lifelong obligations to improve my professional knowledge and competence. Promote, advocate for, and strive to protect the health, safety, and the rights of my patient. With this pledge, I accept the duties and responsibilities that embody the nursing profession. I take this oath voluntarily with full recognition of the responsibility for which I am entrusted by the public. Thank you, guys.
Thank you, Ashley. Y'all may be seated. And at this time, let's congratulate all of our White Coat recipients with applause. Congratulations. At the closing of our ceremony, I would like to invite all of our faculty, staff, students, and guests to celebrate with us and honor our White Coat recipients. At the reception, we have some cookies, and we also have some cake. So thank everyone for attending. We truly appreciate all of the family members that are here. As we were talking about grit, I think you will be the main source of support in helping our students succeed also in their nursing studies. It's as important as the education that we're going to be giving them, making sure that they're taken care of. And as we continue to challenge them with their learning and their education, it becomes more stressful, very fast-paced, but at the end, like Dr. Dunn said, the prize is really priceless. So we're really pleased that you're going to be our first cohort, and we really want to get to know each one of you. So let's take time and share at the reception, okay? Thank you very much.